So, what is active management versus expectant management? So, this is two techniques that are used often in a hospital birth when they are obviously have a system to follow, they have regulations to follow, they have timelines in place. So these are two things. I'm going to explain the difference between them in a second, but these are systems that are used during a hospital birth that matches up with their routine policy procedures, because it has to be the same level obviously over every person that they care for, that it has to be some sort of standard that is the same across the board. But with that being said, you are an individual, you are yourself giving birth. This means that you can bend and twist and move the rules a little bit if you ask for it, because you are an individual and they have to cater to your individual needs and your plan. So active management is where they have a set timeline of when they think people should be progressing. So if you have gone into labour, they will time your contractions, they'll have fetal monitoring on, they will want to do interventions such as cervical assessments to see how far dilated you are, and it will be really quite hands-on care where they are actively managing your birth. So while some people might find this reassuring to know that obviously the baby's heartbeat is beating and that they're not in distress and how many centimetres dilated they are every couple of hours, to a lot of people this is seen as a high intervention, which can actually make you feel more stressed, because if you're not measuring up to how far along they think you should be, then this can then add another layer of stress, which might actually then slow down the process. So yes, active management is where they take a lot of control over where they think you should be, how long you think things should take. So this can often be where they might say to you, oh, you might dilate by like 0.5 centimetre every 2 hours, let's say. That's an expectation. It's actively managing your labour, because nobody is going to labour in the same way. Some people might do that. Some people might get to 4 centimetres and that might take forever, and then get from 4 centimetres to 10 centimetres really quickly. Nobody can know how you're going to labour. So active management just keeps everybody on the same level and basically keeps the hospital beds on rotation. Expectant management is slightly more, it's managed, but it's a lot more expectant of what they think might happen, but not where they are dictating as much of what might happen. So expectant management is more allowing you a little bit more leeway of progressing in your own time, as long as the baby is not distressed, you're not having any other complications, then they're quite happy for you to progress in a natural, more rounded way. And you hear this a lot more in birth centres, where they'll leave you alone to do it in your own way. Yes, they'll be a little bit worried if something takes, let's say, a lot longer than it should. Then the general, sort of consensus is that it shouldn't take that long. They will be a little bit concerned and they might step in and make suggestions. But expectant management is a lot more relaxed of what they might expect might happen. It's not actively managed where they would intervene a lot more. So I hope that makes sense. That is active management and expectant management. And if it is that you are going into a hospital birth but you want to use your hypnobirthing techniques, then you are well within your rights to, when you go to the hospital, explain to them that you want to go more with expectant management because you are wanting to use your hypnobirthing techniques and you want to be left alone quite a lot. You are within your rights to tell them that is what you want to do.